Have you ever wondered if the medications you're taking after 65 could actually be doing more harm than good? Every day, millions of older adults rely on prescriptions to manage their health. But some of these medications carry serious risks that most people don't hear about. Today, I'm going to reveal the shocking truth about 5 common medications that doctors often prescribe to seniors. Medications that can increase your risk of falls, heart problems, memory loss, and even early death. This video isn't here to scare you, but to empower you with the knowledge you need to have better conversations with your doctor. Because when it comes to your health, being informed is your strongest medicine. Stay with me until the end because I'll share real stories from seniors who learned these hard lessons firsthand. Let's dive in. Starting at number 5, benzodiazepines. These drugs are commonly prescribed to help with anxiety and insomnia. They may seem like a quick fix for sleep or stress, but for seniors, they're often a hidden danger. Research from the Centers for Disease Control and Prevention shows that benzodiazepines can double the risk of falls in people over 65. Why? Because these medications slow down your brain's reflexes, impair coordination, and make you dizzy, all leading to dangerous falls. Consider this. 1 in 5 older adults taking benzodiazepines will experience a serious fall within a year. Falls can lead to broken hips, hospital stays, and, sadly, loss of independence. Here's a real story. Marta, 68, started taking a benzodiazepine for anxiety and insomnia. Within 6 months, she fell twice, fracturing her wrist and later her hip. Her doctor explained that the medication was likely the cause. After switching to cognitive behavioral therapy and physical exercises, Marta hasn't fallen since, and she sleeps better naturally. Number 4 on the list, NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen and naproxen. These pain relievers are household names, often taken for arthritis, muscle pain, or inflammation. While they relieve pain, prolonged use in seniors comes with a hidden cost: increased risk of heart attack, stroke, high blood pressure, and kidney damage. Harvard Health Publishing reports that regular NSAID use in older adults can increase the chance of heart problems by up to 30%. Plus, they can cause stomach bleeding and ulcers, even at over-the-counter doses. Let me tell you about Louis, a 70-year-old retiree. He took ibuprofen daily for knee pain. After several months, he developed fluid retention and shortness of breath. Hospital tests showed early heart failure. Once he stopped the NSAIDs and began physical therapy, his symptoms improved significantly. If you rely on NSAIDs daily, talk to your doctor about safer pain management options, like acetaminophen or physical therapies. Coming in at number 3, the dangers of polypharmacy, taking multiple medications that interact harmfully. This is a growing concern in people over 65 who often manage multiple chronic conditions. Certain combinations can cause bleeding, falls, or organ damage. For example, taking blood thinners like warfarin alongside some antidepressants or antihistamines can dramatically increase bleeding risk. A 2022 JAMA internal medicine study found that nearly half of seniors on 5 or more medications experienced potentially harmful drug interactions. Here's a story. Elena, 74, was prescribed an anticoagulant for atrial fibrillation and an antidepressant for depression. Neither doctor warned her about the risks. She ended up hospitalized with a severe gastrointestinal bleed. Since then, she reviews all her medications with her pharmacist before starting any new drug. Managing medications carefully and regularly reviewing them with your healthcare team can save your life.
Number 2 on our list, anticholinergic drugs. These are found in many medications for allergies, bladder problems, depression, and even Parkinson's disease. Studies from the Lancet Public Health reveal that long-term use of anticholinergics in older adults is linked to a higher risk of dementia and cognitive decline. Why? Because these drugs block acetylcholine, a neurotransmitter vital for memory, attention, and learning. Let me share an example. Roberto, 69, was taking an anticholinergic for an overactive bladder. Over time, he started forgetting simple things and getting confused. His family worried he had early Alzheimer's, but when his doctor switched his medication and Roberto started brain exercises, his memory improved considerably. If you or a loved one are on these drugs, ask your doctor if there are safer alternatives. And finally, the number one most dangerous medication for seniors, antipsychotics. Although these drugs can be necessary in certain mental health conditions, they're often prescribed off-label to manage behavioral symptoms in people with dementia, a practice fraught with risks. The FDA warns that antipsychotics significantly increase the risk of death in elderly patients with dementia due to heart problems, infections, and respiratory issues. Here's Carmen's story. At 76, Carmen was given an antipsychotic to calm agitation after a hospital stay. Weeks later, she developed pneumonia and was hospitalized again. Her doctor quickly stopped the medication and focused on non-drug approaches. Carmen's quality of life improved dramatically. This medication is only a last resort and must be monitored closely. If you or a family member are prescribed antipsychotics, ask about the risks and alternatives. Now that we know which medications to be cautious about after 65, let's talk about something even more important. What can you do instead? Here are 5 safer, effective alternatives that can help you manage anxiety, pain, memory, and other common concerns without the risks we just covered. Instead of benzodiazepines, many seniors find relief through cognitive behavioral therapy, or CBT. This is a structured, evidence-based therapy that helps you change patterns of thinking and behavior that cause anxiety or sleep problems. A 2021 study in JAMA Psychiatry showed CBT can reduce anxiety symptoms in older adults by over 50% without the side effects of medications. For example, Martha switched from sleeping pills to CBT. After 8 weeks, she not only slept better, but felt less anxious during the day, without dizziness or falls. If you're using NSAIDs daily for pain, consider physical therapy or tailored exercise programs. Strength training, stretching, and low-impact cardio can reduce inflammation and improve joint function. The American College of Rheumatology recommends physical activity as the first-line treatment for arthritis pain, often more effective and safer than drugs. Lewis, from earlier, improved his knee pain after joining a supervised exercise program. Now he barely needs any medication. Instead of antipsychotics, non-drug approaches like music therapy, pet therapy, environmental modifications, and personalized care plans reduce agitation in dementia patients safely. A Cochrane review found these interventions reduce behavioral symptoms and improve quality of life with 0 drug side effects. Carmen's doctors switched to these methods and her agitation decreased without medication. Now that you know about these 5 medications and their hidden dangers, my strongest advice is never stop or change a medication without talking to your doctor first. But always ask questions. Are there safer options? What are the risks? What happens if I stop? If you found this video helpful, please like, subscribe, and share it with your friends and family, especially anyone over 60 who needs to hear this. Remember, the best medicine is knowledge. I'm Senior's Guide, and I'll see you in the next video with more trusted health advice.